everyone. What did you think of the salsa? Yeah? Yeah, I liked it. I'd never heard of beet salsa, so I should know about that. Hi everyone, I'm Erin Martin. I am the director of FreshRx Oklahoma. It's a produce prescription program, and I'm the president of the Tulsa Urban Ag Coalition. And I am a gerontologist by trade. Has anyone ever heard of a gerontologist before? Oh, yes, of course. My boyfriend's heard of one, yes. So a little bit about my story. I'll explain what a gerontologist is. I started working in a retirement community for 55 and older when I was 15 years old. I was a dishwasher and server, and then I was promoted to the front desk when I was 17, and I was emergency response to 135 residents from 4 p.m. till midnight. And I didn't know that it would be a life's journey and a passion of mine, but I fell deeply, deeply in love with older adults, and really in love with the fact that they didn't care what anyone thought, and they were themselves, they were authentic, and I thought that must be where happiness really is. And if younger people could adopt that earlier on, we'd all be way more happy. And I just loved the darndest things they would say, and the beautiful stories, and the wisdom that they really behold to me. And I really just was so passionate about it, and really just loved being there and loved working there. It was a job that I was always excited to get up in the morning to go do. So I thought, well, most people hate going to their jobs every day, so maybe I should go with that since I really love it. So fast forward, I decided to get my master's in gerontology. There's a school, the first school of gerontology in the world is at USC. And it was founded by Leonard Davis, who founded the school. He was the founder of AARP. And because of some group of folks called the baby boomers, is anyone a baby boomer in here? Yeah? So 10,000 of you all are turning 65 every single day. And because of that and some concerns about how that might tax some of our healthcare system, they founded the School of Gerontology in the late 70s. So gerontologists are very new, and there's all different kinds of roles gerontologists play, but we get education on the psychological effects of aging, the physiological changes of aging, and the social and cultural impacts of aging. And I was particularly trained in how to navigate Medicare, Medicaid, Social Security, and end-of-life issues, and started working as Director of Social Services over 7 affordable housing sites for 62 and older, and really was seeing the systems of aging, the insurance, what it paid for and what it didn't pay for, what food people had access to, and what the effects of that was. And I was learning that actually in the United States, the average is, if you're 65 or older, you're on an average of 15 or more prescription drugs per year. And then I started learning in school, and I was seeing people actually on 15 to 32 prescription drugs. The team I was supervising and the 700 low-income seniors that we were working with. And I was pretty disturbed by that number, and learning about polypharmacy, which is the avalanche effect of you get prescribed a drug and then you have side effects, so you prescribe more and more and more, and before you know it, you're on 20 of them. And so I was really disturbed by that. Was learning in my program that disease is not actually a natural part of aging, and that pain is not a natural part of aging. I said, well, that doesn't make sense, because when I go to work, everyone's like, oh, my back hurts, my knee hurts, my hands hurt, and everyone's got comorbidities, which means you have multiple chronic conditions. You have diabetes, you have COPD, you have cancer, on and on and on and on and on. And that's really interesting. And so I really started looking at something called the blue zones. Has anyone heard of a blue zone? So blue zones, there are about 8 blue zones, some other quasi-blue zones in the world, and this is where the largest concentration of centenarians are, so people who are 100 or more years old. So people do live into their 100-teens. And they live with their daughters who are 90 and their daughters who are 70, and they live very intergenerationally. And there was a lot of things that these communities had in common. They were all very different all across the world, one in Costa Rica, Greece, Sardinia, Italy. I was fortunate to go to Italy and to study death and dying in Italy. And it was really interesting because I'm lactose intolerant. and I'm pretty sensitive to gluten, so thank you for the gluten-free pizza, that I could eat a whole pizza in Italy and I was fine. And I saw people eating Himalayan salt on all the tables, and all the water was in glass, and there were all these different interesting things. And that actually, they revered death, and they honored older adults. And so all of these things I was just picking up, and I was going, there are so many problems that I could be passionate about and help with in the world, but as a lot of my mentors said, you have to focus on something. I wanted to focus on something that had the biggest ripple effect. And I prayed and prayed and prayed and prayed about it and didn't know what that would be. And I kept hearing a whisper, and it was, Erin, it's the food. And so I understood food as medicine and really started to learn more about that. And I was really fortunate right after my master's program, knowing that it had nothing to do with anything that I was working with, but was fortunate to go into a soil health advocacy program with Kiss the Ground. And just admired a friend of mine's work and thought it was interesting, but had no idea it had anything to do with aging. And started learning the soil science of nutrient density and how we could really rebuild the soil, and really learning that we've totally degraded our soils, which means our nutrients are terrible in the food, and that our chronic conditions are skyrocketing, including mental health. And so I was fortunate enough to meet this doctor right here. This is Dr. Kent Farish, and he works at a primary care clinic in North Tulsa, Oklahoma. North Tulsa is a food desert. We have many of those where there's no close grocery stores, and North Tulsa didn't have a grocery store for about 14 years. We have 3 zip codes in Tulsa County that have the greatest mortality rate from type 2 diabetes, and they're all in this area where there's no grocery store, and mostly McDonald's and Dollar General. And we know this is across the country. There's many, many, many food deserts, which is nuts because there's corn growing everywhere, but none of it's for food, and we're in a food desert. So it was really interesting to me. So Dr. Farish came forward, and this was during the pandemic, and of course during the pandemic, all of these cracks in our systems were really highlighted, and so we were very aware of food security and how fragile we are, and how if we didn't have trucking coming in, we wouldn't have food within 72 hours or something like that. And so Dr. Farish came forward to the Tulsa Food Security Council, and he said, hey, my clients are compliant with their doctor's visits, and they're compliant with their medications, but they're getting worse. And they have uncontrolled type 2 diabetes, which means their A1C is over an 8. The scale just goes up to 14, and then you're pretty much at risk to die at any moment in time. And so once you're over an 8, you're at a catastrophically higher rate of having kidney disease, amputation, stroke, death, and of that nature. And so he said he had heard about this study called the Geisinger Fresh Food Pharmacy, where doctors were prescribing fruits and vegetables. And he said, I want to do this program for my patients in North Tulsa. And the council had really put together a subcommittee. They had all the nuts and bolts of the program. They had partners. They were going to source from Amazon or Walmart. And I came into the picture, and I said, I'd love to help with this. I have some free time during the pandemic. I wasn't able to go into long-term care and get clients and things like that during that time. And so they asked if I would carry the torch, fundraise. So I fundraised over Zoom for 4 months. We raised $150,000 and a little bit more for people to get iPads so they could do classes. And we served 52 people the first year. And we gave people free fruits and vegetables every 2 weeks, plus cooking and nutrition classes. And then they had health checkpoints every 3 months to look at some metrics. So Dr. Farish really helped. He is the doctor champion for this program, and he's influenced other doctor champions, which has been really great. And this is the team. So we've tripled in size. We now serve 150 people. So 50 people the first year, 100 the second, and now 150. And all of our team members are of the community, reflect the community that we serve, and all have had incredible health journeys. So Keandra on the left, she's lost over 120 pounds. She has type 1 diabetes. She lost 120 pounds from eating a whole food plant-based diet. Deborah was actually a participant in our program. She went from a 10.6 to a 6.6 in a very short amount of time, and now is one of our team members. So all of our team has great stories to really share about how this really works. So the goals of this program is to reduce their A1C level by 1 to 2%, and that sounds like not a lot, so maybe 1 to 2 points, but the scale is really from like 5.4 to a 14. So 1 to 2% is really big. It equates to $16,000 to $24,000 in healthcare cost savings per year per person. We increase consumption of fruits and vegetables, improve their knowledge of nutrition. We really empower them to, I don't really like the word self-manage, but to self-manage their chronic condition. And actually some people have titrated off of some insulin and reduced their consumption of prescription drugs. And then, I told you I have this understanding of soil science, so when they said, oh yeah, we're gonna source all the food from Amazon and Walmart, I said, no, I don't think so. If I do this, I'm going to source all local food because I know that nutrients will be better if it's local and fresh. And we're going to work with local and underserved farmers who are using good soil health practices because nutrient density will be much, much better. So we have been able to expand our local agricultural capacity and diversity of fruits and vegetables available, and also culturally appropriate fruits and vegetables. So fruits and vegetables that people are culturally really connected to, and it goes much, much deeper than that. And so we commissioned one of our farmers to grow collard greens because that was something our participants really wanted and that wasn't really available. And so we did that. So a little bit about who we serve. We started with 2 clinics actually, Dr. Farish's clinic and one other clinic. And now we're seeing people from 22 clinics all over Tulsa. So we work directly with the primary care physicians and they make a referral. We created a prescription form, so actually write a prescription for fruits and vegetables, and they fax it over to us and we enroll them in our program. So we work with the doctor's offices, the individuals, and we advocate just as much for the farmers. And they've actually become like my favorite part of this whole thing. And so it's been really cool as a result as I've been able to travel and share about this. And really share how this has created a whole new market for farmers and a market that values quality of food over quantity. And I think that's really where we want to go. It's like, okay, we've distributed so many pounds of food, but what did that actually do? And so we get to really show how that happens. So how the program works is, and this is very similar to other produce prescription programs that have gone on. There's actually been 1,000 produce prescription programs that have been done in the nation over the last 20 to 30 years. Most have done little pilot programs, they've raised money like we did, grant funded, and they fizzle out because where's the sustainability for those programs if they're grant funded? They're hard to keep going, but they do prove really great results. And most of the time they're working with type 2 diabetes, high blood pressure, other diet-related diseases, some cancers, and they work very similarly to this program. So we focus on type 2 diabetes, and so they get free food every 2 weeks for an entire year. If they do show some really good results, they can re-enroll in the program. They get 2 to 4 cooking classes per month. We have them in person and we have them on our YouTube channel. So if you go to FreshRx Oklahoma's YouTube, those are free cooking classes, really great, easy, fun little recipes. Some cooking demos are 3 to 5 minutes. So those are available to anyone around the world who wants to see those. So they watch those or come in person. We have a cooking demonstration, then they pick up their food, so it's right there at the same time. And we also offer delivery because transportation is such a big challenge. And then every 3 months, they're required to go back to their doctor, get their A1C checked, get their blood pressure and their weight. And that is all we measure now, and I'm excited to measure more and see what else we're affecting with the regenerative food. But supporting local and underserved farmers, of course, has been an absolute joy. I've really turned over stones to find them. I'm really fortunate in Oklahoma. There's a lot of them using really good practices. There's been lots of people who are just really called to do this, like quit corporate engineering jobs to become regenerative farmers. And so I started at the farmers market and I found three out of several producers that were using really good practices, and some that were full on doing all 6 principles of regenerative agriculture, and just who really got it. And they were really excited to find a program that would value this. And so we have done a ton of advocacy for the farmers. We have worked with the NRCS, the USDA, the FSA. We work very closely with our Oklahoma Conservation Commission and our Oklahoma Association of Conservation Districts, who totally support everything that we're doing. So I saw, after starting to source locally and seeing how limited our infrastructure was to source and aggregate local food, we actually do all of that ourselves, which as we scale, we're gonna have to find some solutions for. But I formed the Tulsa Urban Ag Coalition because I felt like there was so much more technical assistance that the farmers needed help with and support, and labor was one of the biggest needs. And so we created these 4th Sundays, and we need way more than that, but 4th Sunday every month, we go to a different farm. So for example, one day we planted 1,500 starter plants at one farm in one day with a group of people. And so going out and helping with these things, we got this farmer who is showed in this picture, Avery Acres, we got them funded for a hoop house. We actually had 7 farmers funded for hoop houses, and we made sure to advocate all the way through if there were any hiccups in that process. And then we sent someone out to build it after he got funded for it. So we provide lots of support, we provide lots of training for farmers and opportunities. We have a farmer committee, so all the farmers can get together virtually or in person and share best practices, find out what are they growing, what should I grow, how to price things, how to estimate harvests, all these kinds of things. And so I really put a big emphasis on that it's ethical to source local food, and that it's ethical to source well-grown food, and that this creates something called health equity. So there's a lot of people, and especially the people we serve in North Tulsa, they're not on an even playing field as many of us, right? And so it's not creating equality if you are giving people who are experiencing the worst health outcomes the least nutrient-dense food or the worst food that's available. That didn't really make any sense to me. So I feel like through food sourcing and the way we source the food, we provide the best quality food for the people who are experiencing the worst outcomes. And there's a lot of opportunity there by doing that, and how appreciative everyone is. And so this is how we create health equity, and how we're stimulating the local economy that way. So keeping the money there is much more powerful than going to spend it at Walmart. And so obviously a lot of mineral depletion has happened, and vitamin depletion in food from how we have farmed food over the last 100 years. I mentioned you have to eat 8 oranges today to get the same vitamin A and vitamin C as you did in orange 100 years ago. That was in one orange. And so this was a study in 1940 to 1991. There's been 30 years since then. And so we've degraded our soils dramatically by over-tilling the soil, monocropping, spraying lots of chemicals, and it's not one evil thing. It's just a combination of all these things. And so regenerative agriculture is using a holistic management. I really say it's more like indigenous growing. Regenerative is just the hot word. And so I really saw the connection between this and this. The increase in cancers, mental disorders, diabetes, heart disease. And diabetes to me is a real pandemic to me. And that we should really be focusing on that just as much as we have the most recent pandemic. And that actually Indigenous and Black Americans are experiencing this at a great disproportional rate, and actually 1 out of 2 children born after 2000 who are Native American, they actually experience this 6 times more likely than everyone else. And so 1 out of 2 children will have type 2 diabetes. And this isn't just because of things that people are more susceptible to, this is because of the access to the things that they do have that are really creating this issue. So we're really excited to be working with one of the 5 nations that were funded for a demonstration project through Indian Health Services and helping really connect the dots through indigenous growers and indigenous folks that are really experiencing all these chronic conditions. So we've had people come into the program who felt suicidal and have left the program not feeling that way. Because your microbiome and your gut really affect your mental health. And so you are what you eat, and there's so much that can happen. It is truly the biggest ripple effect. And so eating a more whole food type diet and eating more local food and regenerative food if you can is going to be great for you. And so I think this is an interesting point, is that a lot of people think, oh yeah, organic food is superior, but really with organic, they're just removing the chemicals. They're not using other holistic practices, so they're still over-tilling and disrupting the soil organic matter and killing the fungi that is the translator of nutrients to the plant. And people think that, oh, if there's nutrients in the soil, there's just nutrients in the food. Well, that's not actually true. It has to be translated through these processes. So you can see here that conventional is in the blue, organic is in the orange, and then the greenish color on the right is regenerative style farming. So they show that regenerative style farming has much more nutrients in it. And then Bionutrient Association, Dan Kittredge, did a study to show what's the nutrient variation in the food supply currently. And the biggest one that's on here is that spinaches can range 365 to 1. So that means you could eat 365 of the least nutrient-dense spinach that you could get in one piece of spinach. So you just think about how we are not eating very efficiently and eating too many calories to try to get as much nutrients. So your brain won't be satiated. It'll keep eating to try to get the nutrients that it needs. And that computer won't shut off. So people are more than likely overeating because the food is depleted. So carrots are 3 carrots equal to 1 and so grown in optimal growing conditions. And what they found is most nutrient dense is grown in the soil with regenerative practices. And your tongue knows. It tastes better. And so I think that that's one of the components of the program, is that people come into the program and they go, wow, I don't think I've ever had a carrot before. And including me, I've had food from our program. I thought, wow, I really haven't had a real vegetable ever before. And so people think they don't like vegetables, and then they come to us and they're just blown away by that. So your tongue is a great litmus test. Not always with the highly palatable foods that are a lot of money and research and development to produce, but your tongue can change and become more into the things that are good for you as you start to cut out more of those processed foods. So I had never liked tomatoes for the longest time, but when I changed my diet, I started to like them more and more. I like cherry and grape tomatoes better, So, this kind of gives you an idea here, because I know the range of A1C is probably a little foreign. So you can see if someone drops, it stops at a 14, but I couldn't find when that stopped there. But you can see that a drop from a 12 to a 10 is going to be a major, major change. And so again, our health outcomes, we had 30 out of 40 people, so we had 40 out of 52 finish in the first year. We had 30 out of 40 have some type of reduction in their A1C, and the average reduction across those 30 people was 2.2%. And our greatest reduction was from a 14 to a 6.9 the first year. Our second year, our greatest reduction was from a 13.6 to a 5.4. That means that they fully reversed their type 2 diabetes. And it has been documented many, many times in many, many studies that type 2 diabetes is not inherited. It is completely reversible with food and exercise, and mostly food, actually. Our first year, the cohort lost 296 pounds. The greatest weight loss was about 54 pounds, and then the second year, our greatest weight loss was 72 pounds. And so I always ask the team, like, did they just have some major surgery and that was the deal? And they said, no, they look fantastic. They went from weighing 380 pounds down to and losing 72 pounds. So we've helped 15 farms expand, 10 farms increase their crop production, and 10 new crops produced by 5 farms. So really creating this new market for farmers. And then the University of Oklahoma did a study and said, okay, so if we replicate these, if we're able to continue to produce these outcomes, if we serve 1,200 people, we would save the state of Oklahoma $25 million in healthcare costs, but it would only cost $3 million to do it. So, for people, I always say, for people who are capitalists who don't care about humans as much, that's a good ROI, right? So that's what I tell our legislators all the time. And I just want to share this little video with you real quick.
Woman says access to locally grown fresh fruits and vegetables is really improving her health.
She participates in the Fresh RX food program and tells News on 6's Sawyer Bussey she's already seeing an improvement in her diabetes numbers.
Well, you got a lot of colors there.
Oh yeah, that makes it pretty. That makes it pretty.
Welcome to Deborah Cooper's kitchen.
And put my peppers and onions in first. Like I said, they don't make you feel like you're getting a handout. It's like come and get some longevity. Yeah.
It hasn't always been this way.
I was best friends with Little Debbie and her snack cakes.
Deborah says unhealthy foods were also friendlier to her budget and at times much more accessible than fresh local produce. Over the years, Deborah's sweet tooth started impacting her health. She was diagnosed with type 2 diabetes in June, and as a patient at Crossover Health Services was connected with the Fresh RX team.
Our body can heal itself if it gets what it needs.
Fresh RX is partnered with Oklahoma farmers, community partners, and patients at Crossover Health Services to bring fresh, locally grown produce to 52 participants with dangerously high A1C levels and type 2 diabetes.
Food is medicine, and it has this huge ripple effect.
Deborah is one of the Fresh RX participants. In less than 11 weeks, her A1C levels have gone from a 10.6 to a 7.1.
They gave us all of these recipes with the items we were picking up. So that's like you gave me not just a car, but you gave me the keys too. I have even passed up Debbie. I see where they set them out. I just hold my head up and say, girl, bye.
Deborah is a pastor of a growing ministry, and her physical health is starting to match her spiritual health. She says the same results are possible for others.
What I'm called to do, I want to be here to finish it, and I want to do it in excellence. And this program, it is life-changing.
Real outcomes, real food, real people.
Sawyer Bussey, Oklahoma's own.
You should have your own cooking show.
News on 6.
I think you should.
So how are these programs going to be sustainable? We know they work, right? Or have I convinced you yet? So, currently the Farm Bill funds these programs all over the country. Fortunately, there's none in North Dakota, but there are several in South Dakota and there's several in Minnesota. So those are funded through the USDA Farm Bill. There was a man named Michel Michon, who's a chef. He founded Wholesome Wave, which helped develop something called the Double Up program. And it's called different things in different states, but it's for people who are on SNAP or food stamp benefits to double their money up to $20 a day if they eat fruits and buy fruits and vegetables. And many of these organizations require that a certain percentage is sourced locally. So it started with these nutrition incentive programs to double their money and incentivize people to eat more healthy. And then they created produce prescription programs where doctors actually prescribe these to people with diet-related diseases. So this became legal in the Farm Bill, and the fund was dramatically increased last year. So we were fortunate to get funded through the USDA last year. So we have some extra grant funds through 2025, and we can keep fundraising, but what's the Holy Grail? The Holy Grail is to make sure insurance pays for these programs as an insurance benefit. And there's lots of people interested in that. And actually, there's something called the 1115 waiver. It's a state waiver that is passed at the state level for Medicaid, so that would be your lower income state insurance, to pay for produce prescription at the state level. And 7 states have passed this. Most recently, Washington State has passed this, and there's a group called the National Produce Prescription Collaborative that is getting CMS, Medicare, and Medicaid to fund this program permanently. And there's many plans, including Medicare Advantage programs that some of you might be on, baby boomers in this room and older, probably on Medicare. And if you're on a Medicare Advantage plan, some of them are starting to pay for these programs. There's also something called medically tailored meals that are prescribed when someone is right out of the hospital, and they're prepared meals. And so produce prescription is a little bit more preventative or can extend beyond the medically tailored meals, but medically tailored meals are being used nationally already. I don't know the sourcing of a lot of these things, but I am trying to influence it as we go along. So we were able, in Oklahoma, we just created a statewide coalition to pass the 1115 waiver. Harvard University put out this grant that's not in the form of money, but it's in technical assistance to provide 2 states in the nation with a team of lawyers to pass the 1115 waiver. And just a few days ago, Oklahoma was selected for this work. And Kansas said, we never look to Oklahoma for what to do, because we do have the worst health outcomes in the nation pretty much. They said, but for this, we will follow. And Nebraska is saying similarly. So I am very, very hopeful that in the next 5 years, CMS will be paying for produce prescription. It will save us billions and billions of dollars in healthcare costs. And I'm really fortunate to be able to help Oklahoma do that and to help influence surrounding states and others in the area of how we can do this and how do we scale, but scale in a way where it's more localized. And I think we got to some of these problems by worrying about scaling so much. Really creating localized groups of farmers so we could really at the same time be improving the health of people in rural areas, but revitalizing rural economy at the same time. So the ultimate ripple effect. So how can you get involved? Well, depends what you do. If you're a farmer, it'd be great to connect with some of these programs. Maybe if you are near South Dakota or Minnesota, I can definitely help you. I'll have my email at the end of this slide. I can show you what programs those are. If you're a consumer, there's lots of ways, right? Eating more local, advocating for that, buying at the farmer's market, or subscribing to something called a CSA, which is a community-supported agriculture, which is a farm subscription to a farm. And really also if you have relationships with your legislators, letting them know this is something that's happening, that's taking off, and it can really help us out, and it could actually stimulate local economy. And if your state really likes more of a business plan, this is it. There's a huge ROI. So there's lots of ways you can get involved. If you have an organization or a nonprofit that's interested in executing a program like this, I can certainly help with program implementation and design and helping with those kinds of things and giving you some best practices. I had to learn a lot from other people that warned me of all the challenges because it's not simple. And we took on a beast by sourcing and aggregating all by ourselves, so I have some experience there. And here's my information. And I hope that this has been enlightening, and I just want to open it up for any questions. If there was something I didn't hit or something I can help on, and I'll repeat the questions as well. Yes, ma'am. So our food bank helped a lot during the pandemic with people that really needed anything. They actually have now the local food purchasing grant that many food banks have received. So they have money to actually buy local food. So what we've done is we have sourced from our local farmers, and if they have more food that we can't buy, we've connected them to the food banks so the food banks can buy their food. So that's been a really, really cool program, and we're hoping it doesn't run out and then doesn't continue because it's really great. So we've been working on also creating a regional food hub in the area. Oklahoma City just started one, and then we sometimes go to Northwest Arkansas as well. But the food banks with the local food purchasing has given the farmers, they're not hesitant to over-harvest, and they actually have a deal with the farmers market in Tulsa where if they don't sell everything at the farmers market, the food bank will buy the rest. So that's been a really cool thing to see. Yeah. Anyone else? Okay, well, yes. Yeah, that's a really good question, and I didn't repeat your question, so I'm sorry. She was asking what we've done to partner with the food bank, so if you can put the answer to that question, sorry. And then the second question was, do we think our backyards are as degraded? I would say maybe not as much, but we're still when we have just yards with one type of grass, that's still like monoculture. And so diversity is what feeds the microbes and the soil organic matter that produces nutrient-dense food. So putting compost down is a great way to do that, and making sure your garden is diverse of different types of vegetables or different plants. The more diversity, the better, and pollinators would be fantastic. So I don't know what the exact comparison is, but we're still spraying lots of chemicals and only maybe growing one type of grass. I high mow and I have lots of pollinators. I don't grow food in my backyard, but these are all things that you can do if you compost, get a little composter of your food left over, and you can put it out there in your garden and things like that. So, yeah. Yes, ma'am. How do we keep our supply up during the winter months? That is a really good question, and that's going to be a little bit different up here. So we have high and low tunnels that the farmers use, and actually people told me there's no way you're going to do this year round. And I said, okay, I like a challenge. And we've actually served food every 2 weeks since July of 2021. We have, in winter months, we have lots of storage crops, a lot of daikon, beautiful purple radishes that people probably got tired of. We supplemented with some dry goods that were locally sourced, like rice and beans and different things like that. But what's really cool is there's a guy in Maine that extends his seasons 2 to 3 seasons at a time and grows year round. So if you can do it in Maine, I figured we can do it in Oklahoma. And another really cool thing that I've learned and got to actually visit was the underground greenhouses, which is a rendition from Wallapini's that Native Americans use. And so in Nebraska, this older gentleman, he's 93 now, he's sold like over 400 of these over the world. He has 17 species of citrus being grown underground in Nebraska. So I think there's lots of different ways to do it. Obviously, being able to have storage crops and things like that to extend, and then high and low polytunnels is a lot of what people are using to extend this season. So we have a lot of greens like during the winter, and it's not as diverse as right now, but we have been able to do it. So, yeah. Like, is the food cooked? Yes. So the question is the food that we're giving them cooked? No. No. Yeah, the food is raw, and then we're teaching them how to cook it, so when they go home, they know how to cook it. And I also wanted to mention, because the great demo earlier, that we have a value-added product that we show how to kind of stretch the food. So we have a value-added chef that will take like leftovers from the food that we're offering and make a value-added product. So salsa, pickled onions, to really show how to stretch that food. So that's the only thing that we show that's cooked or prepared, but it's all whole fruits and vegetables. So these are folks that have the ability to cook and prepare. And then we do give them a startup kit, so they get some tools and a cookbook and a storage sheet on how to store the different fruits and vegetables and things like that. That answer your question? Yes, as far as we know, when they go home, we check and make sure their appliances work and things like that. I'm sure lots of it would go to waste, and maybe it takes them a while to figure it out. We also have correlating recipes every time, especially if there's something new. And we try to introduce new things, but also things people are really connected to, like okra, and new things like microgreens and stuff we can have year-round. And we do occasionally have a backup, like hydroponic operation that will give us lettuce and things if we're just really low. But yeah, so they're supposedly cooking. And actually, we did a survey and said, would you rather prepared meals? And they said, no, we love to cook. And we just didn't have access to anything. Yeah, like telling them to cook the raw vegetables? Well, yeah, it's more nutritious if it's raw, I believe, as you're cooking it. And we also tell them to not overcook things, and so instructing them to do that so there's still a crunch and stuff, and really helping them understand those things. But yes, I'm sure they're cooking a lot of it, but maybe they're eating some of it raw, and we do talk about a little bit about that. We give very general kind of health information, but yeah, that's a great question. Because the more you cook something, the more, yeah, it also degrades. So you get it and it's depleted, and then you cook it down and there's like nothing in there, right? Yeah, anyone else? Okay, well, I'll be around, and thank you all for listening.